Springs, and welcome to this edition of DAP Live. Today, we're talking with CJ Tobe, the Director of Community Health for Desert AIDS Project, and he's going to talk about the importance of access not only to care, but also to information. You won't want to miss a minute of the conversation, so grab a cup of coffee, and we'll get started. All right, so our first guest is CJ Tobe. He's the Director of Community Health at Desert AIDS Project. And he's got a long career working in community health, and his team has been busy innovating during the COVID-19 pandemic to make sure that the organization is able to stay connected and do the vital work it's doing to make sure folks have a connection to testing and treatment. Good morning, CJ. How are you?
Good morning, Stephen. I'm doing very well. How are you?
I'm great. I'm great. So I'm a big fan of what your team's doing. I've been watching it pretty closely. But you know, the COVID pandemic has changed how all of us do what we do. Tell me a little bit about how community health has been innovating to continue doing its work.
Yeah, absolutely. So, in the middle of a crisis, what does that lead to? And it leads to innovation. And that's exactly what we've done at Desert AIDS Project, but specifically the Community Health Department. And so, one of the key things that we have done is we have created and launched a food delivery program. We've identified our most vulnerable patients here at DAP who have been staying at home during the stay-at-home order issued by the governor. But we knew that we needed to get services and supplies and essential food to our patients. So we designed this program where we're able to deliver food to our patients. And then also what's wonderful about this is that any community members who come through our DAP triage clinic will also be eligible for this food delivery program as well.
That's great. Now, before the pandemic, of course, your main focus was Get Tested Coachella Valley, the DOC, HIV testing, STI testing, and PrEP. The pandemic has taken the attention off of that critical work a little bit, but you did launch a Sex During COVID campaign. Tell me about that and the results that you're seeing from it.
Yeah, you're right. So it was late March when we were really just kind of getting in the middle of the COVID pandemic, where we received 7 new HIV diagnoses, which is really unprecedented at Desert AIDS Project in this time. And it was really a reminder to all of us that have been working in the HIV field that just because we're in the middle of a pandemic does not mean we should take our pulse, take our finger off the pulse of the HIV epidemic that we've been battling for over 35 years. So we launched a Sex and COVID digital campaign to really reach the people that were still engaging in sex, even during stay-at-home orders, and to be social distant from others. Because we learned through the AIDS crisis and through the last 35 years that people resort to sex for many different ways. It could be for stress relief. It could be to survive, for food. It could be because they have sex addiction. It could be because they need a roof over their head. Maybe it's to cope and not feel so isolated. So people turn to sex for many different reasons, especially during a crisis. And so we wanted to make sure that through this campaign that, yes, we were encouraging people to stay at home and masturbate or play with yourself. However, the reality is that people are going to do what they want to do, and that our services here at Desert AIDS Project will still be here in a judgment-free, compassionate way for anybody who needs them.
And the work that you do, it's activism, it's advocacy, it's social justice. So much of what you do is reaching marginalized communities, including communities, persons of color. I see a lot of what you're doing is in Spanish language. Tell me about that work and why it's so important to make sure that you're reaching every community that may be at risk.
Yeah, so what we've seen through the data with the HIV epidemic in the last couple of years, that new infections for HIV in the country, they have been decreasing amongst white people. However, the people of color community, the Latino community, the Black and African American communities, those numbers are either trending the same or increasing in some areas as well. And so we need to make sure that we direct a lot of our focus, a lot of our resources. It really provides services, building those relationships with those communities to let them know that we're here to provide access to people who need it most.
And
And
what,
I can also say, Stephen, that during the COVID pandemic as well, COVID-19 is now attacking the people of color communities more so than it is the white communities as well. And that's something that I don't think gets enough attention and that people are very unaware of.
what you're talking about, of course, is access to care, right, and access to information. Um, why are some communities at a disadvantage when it comes to access to both care and to information?
So that's a loaded question. I think it could come up with a lot of responses. I think one, there's always cultural, religious, ethical beliefs that go into any kind of stigma or groups of people being uneducated. I also think that poverty is the driving factor for, from what I see here in the valley for new HIV diagnoses. Um, there's so many. It's a multifaceted problem with HIV to where there's not one solution or one issue that is preventing people from getting access. People are being mistreated across this entire country for the color of their skin. People are getting mistreated for how much they make, or if they have a job, or if they have a roof over their head or not. I'm a big believer that something that we all have in common is we all want to love and we all want to love others. And I really think that would probably be the foundation that we can maybe build upon to providing access to people who need it most.
We had a conversation with Rich Richmond from the U equals U campaign, and you were referencing stigma. And of course, that campaign, part of it is meant to reduce stigma and reduce anxiety around testing and treatment. Tell me a little bit about your approach using U equals U in the language to educate and affirm.
Yeah, so the U equals U campaign, I'm actually shocked that more people don't know about it. Undetectable equals untransmittable. People living with HIV, if they're taking their medications as they're supposed to and they become virally suppressed, will not transmit HIV to another person. I almost feel that we should be standing on top of the rooftops yelling U equals U to get the messaging out, because here we are in 2020 and I use social media apps and chat with people, and there's a lot of people who do not know what undetectable is just within the gay community. And that's unfortunate, but knowledge is power, and the only way to be able to get that information out is, one person at a time and having open conversations about it.
Yeah, facts over fear, right? So tell me about the work that's still being done. I know that we're still in the COVID pandemic, but testing and treatment, your prevention efforts continue. What can people find currently at Desert AIDS Project around the community health area?
Yeah, so what we were doing during the pandemic is we knew that access to HIV testing and then STI testing was crucial, that we did not want to take our finger off the pulse of the HIV epidemic. And so we implemented at-home HIV tests that anybody can request that we'll send out to, but specifically to the recovery centers and treatment facilities that we were frequently going there to provide education and testing. We're now in the middle of actually training recovery center staff to be able to provide that at-home HIV test with their clients, with us community health staff over Zoom. So we've been able to do that. As far as STI testing, we all know that if you have an STI, you're almost two times as likely to contract HIV. So routine STI testing and treatment as needed is crucial in ending the HIV epidemic. And during stay-at-home orders, as I touched on earlier, we knew people were still engaging in sex for many reasons. But what we wanted to do was make sure that we could provide STI testing to people, but yet limit their exposure to COVID-19 as well. So we took our Get Tested mobile unit and parked it in the DAP parking lot for several weeks, really during the start of the COVID-19 pandemic here in Riverside County, to provide an alternative way for our community members to come in and get tested for STIs without going into the clinic. So we were able to limit COVID-19 exposure by providing that STI testing out of our mobile unit.
And I know that PrEP has been one of the tools kind of in your tool belt in combating HIV. Talk to me a little bit. I've heard some reports that some men have stopped taking PrEP during the pandemic because they've been isolating at home, and now we're leaving our houses again, and maybe we're connecting again. What should we know about access to PrEP before we make those connections?
Yeah, so first of all, I want to talk about the first point that you made is there are a lot of people across this country that have stopped taking PrEP during stay-at-home orders. And I think now, as we're reopening the country, and some people are reopening their sex lives again, is to really take charge of your sexual health by doing a multitude of things that can potentially help you. One would obviously just be to not have sex until you call your doctor and you get your appointment and get started on PrEP. However, that's not going to be feasible for everyone. So we could use condoms maybe for the first week or two with our sexual partners, even though we hate using them, and we don't use them while we take PrEP, some of us. So maybe we use condoms for 2 weeks until we can get in to see the doctor and get started on PrEP again. Maybe we only have sex until we can see a doctor with our previous sexual partners, people that we may have a history with and we've already had dialogue and have a rapport with about our sexual health, and that we both, test frequently, right? And then I would also say that the number one thing for PrEP right now would be to just contact Desert AIDS Project, get a hold of our amazing PrEP navigation team. They will virtually enroll you into whatever program you're going to need without having to see you face to face. They get you that appointment so we can get you started on PrEP.
That's great. If someone's watching this and they're just we're always curious about how our allies can be part of the solution, right? And how the community can support the work that Desert AIDS Project is doing. What's the one message that you'd want to give to somebody who is perhaps has the ability to amplify your message? What should they be telling their friends and their community members about sexual wellness?
So I guess what my advice would be that HIV does not discriminate to anyone. Anybody can get HIV. It doesn't matter who you are or where you live or how much money you have or what insurance you have or who you're married to. Anybody can get HIV. And so I think for sexual health right now, especially since a lot of people who have been speaking up in the last several decades about their own sexual health and trying to reduce that stigma surrounded by it, a lot of those people had to go into the closet now recently with this COVID-19 pandemic, so they don't become shamed, right? Why are you having sex during stay-at-home orders? So the message I would want to get across is to have a conversation. It could be a friend, a family member, a sexual partner. It could be a person in the store that's buying condoms. Go up and talk to them. Start that conversation about sex and sexual health because it's empowering and it's our bodies. And what we want to do is we want to just make sure that everybody's provided all the updated information and all the tools. And then when you make those decisions, you then can make whatever decision you want based on the information you have. But sexual health is empowering, and I encourage people to be talking about it.
I love that. And we'll put all the information, of course, below here. And I love that because it's facts over fear, and information is empowering. Having those authentic conversations with the people you care about, it makes a big difference in your wellness and the wellness of those that you care for. Of course, CJ's team is available if you have questions about PrEP or about STI testing. And we'll put all the information, the phone number to call, and where you can get care and treatment during this interview, and you can make that phone call and get the connection you need. CJ, thank you so much for talking with us. We really appreciate it.
Thank you for having me, Stephen, anytime.
Well, that's our show for today. Thanks for joining me for DAP Live. Tune in every Wednesday at 9:30 as we continue to talk with community leaders that are making a difference right here in our community. And if you know someone that you think should be a guest, send us a message and we'll make sure that we invite them to join the conversation.